So we've done the emotional exam, done the clinical exam, over here psychology, and it was a basic case. Let's just say, like you presented, you were really healthy, but the gums were bleeding, right?
Right.
So the only thing that's going to be our treatment plan is scalar root plan in this scenario. However, you could use this in phases. You could do lots of dentistry presented with this, okay? So case presentation form, I sit you up and I say, Connie, I know earlier you shared with me that it was really important for you to not only maintain things in a healthy way, but also not go down the same path that your mother did in losing her teeth.
Right.
Right. Okay. So being on the same page and keeping that in mind as we did the exam, the things that you heard us talking about were the numbers with the health of your gums, right?
Oh, yeah.
And the concern was you had bleeding, but not a big deal. It's been there a while. We looked at it, looked at pocket depth, and going, that bleeding's telling you, sending you a signal. Your body's sending you a signal saying, hey, something's wrong, something's wrong. And I would liken it to the post in the ground with cement around it. Imagine cement eating termites, eating not the wood post, but eating the cement around.
Mm-hmm.
And the blood you see is the result of that bacteria and infection coming up, and that cement going down, right?
Really?
So what happens is that post starts to get loose. That's your tooth. So when you have this infection, it leads to. Well, Diane, are you recording?
Yes.
Yeah. So we'll use
I'm
Diane's.
sorry.
Yeah, that's okay. So that infection then leads to tooth loss. That may be the same way that your mother lost her teeth. I'm not sure.
Okay.
But that may be what happens because there's no pain involved. So when you see the blood, but there's no pain, your mind doesn't register there's a problem here yet. There's a signal, but not a problem. So the issue is the infection that gums. The reason that's a concern is because it leads to tooth loss. And it's a slow death for that tooth, right? So the question now becomes, do you want to prevent that from progressing where there's no return, or do you want to stop it now before it gets to that point? So how concerned are you with that?
Well, I don't want that to happen.
Okay.
So.
All right. Well, that makes sense. That makes sense. So would it make sense for us to talk about a plan together on how we can stop it now before it gets too severe?
Yeah, but how much is that going to cost?
Let's talk about it. Let's come up with a plan that works for you. Okay?
Okay.
All right. So if we do this, if you let this progress and then you get, I got to have surgery, that gets expensive.
Yeah.
We're trying to prevent that expense.
Okay.
Does that make sense?
Yep.
So if we do this now, you would see the hygienist because you have 4 areas in the mouth, 2 upper, 2 lower. And the infection is spread throughout your mouth. So we have to treat all areas. We can't treat all of it at the same time because you don't want your whole mouth to be numb.
Right.
So what we would do is we would treat maybe one side at one appointment, then within 2 weeks, treat the other side. You would be numb. We would allow the hygienist, that would allow the hygienist to clean the areas your toothbrush can't reach. We talked about beyond the 3 millimeters,
Right.
4, 5, 6 millimeters, she's able to clean that out now. Get those termites out of there, and hopefully get reattachment as well to create a sturdy foundation again.
Okay.
All right. Now, how do you feel about doing that? You mentioned the cost. You want to figure that out?
I want to figure that
All right,
out.
so
but I
that
do-
plan, that's the plan we want to do. Let's
Yeah.
figure out the cost. We don't want to wait till surgery and more
No,
expensive.
I don't want. No.
So let's do this. Let's go up front. We'll look at the total cost. You know, my best guesstimate would say somewhere between $800 and $1,000 is the total cost for the whole mouth to get done. Now, if you're to look at a surgery down the road, you're talking 4 times that amount.
Okay.
So if you want to save your teeth, it's never going to be cheaper than it is now. The question is, typically with patients, how do we fit that part into your budget so that you don't have to come up with $800 to $1,000 all at once unless you want to?
Okay.
Does that sound all right?
Yeah.
So let's go up front. We'll figure it out.
Okay.
We'll see what your insurance plays a part in this. We'll see what your out-of-pocket is and all those things. Does that sound
Sounds good.
All right, let's go do that. All right.
All right. Thank you.
All right. Thank you.